Hi, Miss Nikki here. Welcome to Chapter 7, the Skeletal System. We're going to go through these PowerPoints and we're going to look at the 206 bones that we have and all of the features on those bones. Hold on, here we go. So now we're going to talk about the appendicular skeleton, and we can break the appendicular skeleton up into two separate sections, the pectoral and the pelvic girdle. So the pectoral girdle, we usually think of our pecs, our chest muscles, so we can think of upper limbs. The pelvic girdle is going to be the lower limbs, so this is going to be our hips and lower legs, and we're going to talk about the hips. Sometimes they're called coxal bones that make up our hips, or sometimes you'll see os coxa. Let's talk about the clavicles. The clavicles, we would call them collarbones, but now that we know the anatomical term, we're going to use clavicles. The clavicles are going to articulate or join to the sternum and the scapula, and they're going to help anchor muscles, and they're also going to act as a brace. So the scapula is the other bone, along with the clavicle, that make up your shoulder joint or your pectoral girdle. We're not going to call it the shoulder blade anymore. The features that we need to be able to identify are the spine that's on the back side or posterior side, and the glenoid cavity where your humerus will articulate. So here's a figure representation of the pectoral girdle. So you can see all of this structure here is the scapula. All of this structure is the clavicle, and the clavicle and the scapula have an articulation point or a joint. And then we can see here, remember this was the manubrium of the sternum where the clavicle is going to articulate. So there were two other features. There was the acromion end and there was the coracoid process. So this is the coracoid process. We're going to hook muscle attachment onto that coracoid, and the acromion is where the clavicle joins the scapula. Here we have the glenoid cavity. This is the last feature that we needed to be able to recognize on the scapula. And you can see here that this is the site of articulation for your humerus and your scapula. On the posterior side, we have our spine. So you can see the spine on the back side or posterior side. This is the ridge that you feel. If you grab your arm and grab your shoulder blade, you'll be able to feel, I should say scapula, right? You'll be able to feel this ridge, and that's the spine of your scapula. The next slide we have to talk about is the upper limb. So there are about 30 bones that form up the skeletal framework for each of these upper limbs. We're going to talk about the arm, which is the humerus. We're going to talk about the radius and the ulna, and we'll talk about some of the carpal, metacarpals, and phalanges that make up the hand. So on the humerus, this is the longest bone of the upper limb. Superiorly, it's going to articulate with the scapula and that glenoid cavity. Inferiorly, we're going to see on this side, we're going to see the radius, and on this side, we're going to see the ulna. And the features that we need to be able to identify are the head. So this is the head of the humerus. This rounded knob is the capitulum. Maybe I should erase that. Here's the rounded knob, which is the capitulum. And this is the trochlea. Kind of makes this weird shape. The olecranon fossa, we're going to have to look at the back side to view. Here's an anterior view again. So we can see the capitulum, which is here, and we can see the trochlea, which is here, and we can see that they articulate with the radius. So the radius is on the capitulum side, and the ulna is on the trochlea side. With the posterior view, we can see the olecranon fossa. So it is the shallow basin, and that this process is going to fit into, the olecranon process. This is actually on the ulna. So basically, this is the basin that the ulna is going to fit into. Within the forearm, we're going to look at the ulna and the radius. Probably the best thing is to say that the radius is on the thumb side and the ulna is on the pinky side. The ulna is the medial bone. It's on the inside. The radius is the lateral bone. It's on the outside. And the features, we're going to look at the olecranon process, which we just saw, but we'll look at it again, the trochlear notch, and then the head of the radius. So here is our radius, and here is our ulna. So the radius is on the outside, the ulna on the inside or medial. The olecranon process is the outer edge. Remember this olecranon process? It's actually your elbow. And then we have our trochlear notch. Our trochlear notch is the inside. So trochlear notch is the inside of the ulna. The olecranon process is the outside of the ulna at this particular location. Then we have the round head of the radius. It looks kind of like a radio dial. Now we move on to the carpal bones. So these are the bones of your wrist. We have 8 bones, and they're in 2 rows. There's a distal row and there's a proximal row. So we're going to look at that figure in just a moment so we can look at each one separately, but here's the mnemonic. Sally left the party. Sally left the party to take Kathy home. And you can say Sally left the party to take Kathy home. So let's look at those in just a moment. So now we have metacarpals and phalanges. So the metacarpals, these are the bones of the hand. And then your phalanges are your fingers. So we're going to look at how they're named, and we'll look at the digits of the phalanges in just a second. There's a distal phalanx, a middle, and a proximal phalanx, and all together they make up phalanges. Great figure here to go through carpals and metacarpals and phalanges. So with the carpals, you have to make sure you're in the right orientation. So here's the radius, here's the ulna, and here's your thumb. So we're looking at an anterior view. Our hand is palm down on the table. You can see scaphoid, lunate, triquetrium, pisiform, trapezius, trapezoid, capitate, hamate. So Sally left the party to take Kathy home. So these are all of your carpals. Also, you can see trapezium is under the thumb. Sometimes people use that as a good reference point. For your metacarpals, you have, these are your hand bones, right? So the bones of your hand are numbered 1 through 5, with 1 being your thumb. So if I had a break here on this hand bone or this metacarpal, I could say I had a 4th metacarpal fracture, and I would know exactly which bone on your hand was broken. For your phalanges, these are the same as fingers, right? So these are your fingers. This would be your line of your knuckles. So your phalanges consist of a distal, a medial, and a proximal phalanx. So phalanx is 1, and phalange is many. So I have a distal phalanx, a middle phalanx, a proximal phalanx. All together, they make up phalanges. Again, you can use this to easily denote where a fracture might be located. So if it was here, you would say this is a 5th distal phalanx fracture, and we would know we were automatically talking about your pinky finger all the way at the very end. Now we have to move to the pelvic girdle. It's made up of 2 hip bones. Sometimes in the book it'll call them coxal bones, or you might see os coxae, or you might also see ossa coxa. There's many different arrangements depending on if it's singular or plural. You can go with coxal bones or you can go with os coxa. Either way is fine. So these are going to be the attachment for the lower limbs to the axial skeleton. It's going to transmit the weight of the upper body to the lower limbs. It's going to support the pelvic organs. And these coxal bones are created from the fusion of 3 separate bones. So we're going to look at the ilium, the ischium, and the pubis. And then the other feature that you need to be able to identify is the acetabulum, or the socket with which the head of the femur is going to articulate with. For this figure, we can look at the coxal bone. So right here, this is one, and this is the other coxal bone. The coxal bone is made up of 3 separate bones, the ilium, the ischium, and the pubis. I'm going to wait till another figure to show you those because it's color-coded and it's a little bit easier. But basically, we can break this into 3 separate sections that would make up the coxal bone. What I want to point to is the iliac crest. It's this ridge here on top of the ilium. There's the sacroiliac joint. That's where the sacrum and these coxal bones are going to meet. Remember, all of this is axial. So we said this is the weight from the axial skeleton. This is actually part of your vertebrae, right, your sacrum, and that this is going to articulate with your two pelvic bones to help support all of the weight above this area. The acetabulum, this is the socket, and we can see right here, this is the socket where the head of the femur is going to fit. And then the pubic symphysis is this cartilage piece right here, and this cartilage is going to allow for the compression during walking. So this is a nice cartilage pad that's going to stop the bone-on-bone friction from any sort of movement, just like when we had the costal cartilage on the rib cage. Here's the color-coded version of the hip bone that I wanted to show you, or the coxal bone. So you can see where the delineations are here in color. So the ilium is on top of the iliac crest. It's the fan-shaped section of the coxal bone. The ischium is on the posterior side. This is the rounded section. And on the ischium is the ischial tuberosity. It's basically this rough patch. And we're going to see some muscles that are attached to this ischial tuberosity when we get to the unit on muscles. The acetabulum is this large socket where the femur, head of the femur is going to fit. And then the pubis is this pointy part here. And the pubis is going to face towards the anterior. And you're going to have, when the two pubis or pubic bones meet together, you're going to have that pubic symphysis. The obturator foramen, it is the large hole that's going to extend between the ischium and the pubis. We're going to see blood vessels, we're going to see nerves all innervating or going through this obturator foramen. Lower limbs, basically they're going to carry the weight of the body. So all of the weight from the head all the way down, my little stick man, is going to eventually end up on the lower limbs. There are three segments. We have the thigh, which is the femur and the patella. This is anatomy term for kneecap. Then we're going to have the tibia and fibula. Please denote the endings. It's one of the things that we mix up. The fibula is the lateral bone, so maybe the LA will help you remember it's the bone on the outside, and the tibia is the bone that's medial on the inside. There are 7 tarsal bones in the ankle. We're still going to have our same setup for metatarsal and our phalanges, but the tarsals are going to be one less. Okay, so the thigh, here's the femur. The parts or the features that we want to focus on are the greater and lesser trochanters, and then we want to be able to identify the patella. So to put it in anatomy speak, the femur is going to articulate proximally with the acetabulum of the hip or the coxal bone, and distally with the patella and the tibia. So here's our femur. It is the largest bone in the body. We're going to see the head of the femur. We're going to see lesser trochanters, that's these little notches, and we're going to see the greater trochanters here and here. And obviously these are larger. These are hooks, and we're going to have muscles attached to these hooks. Here's the patella. The patella is going to fit right about here on the femur. So that's why they say distally we're going to see the tibia down here. We're going to see the patella here, and then at the proximal end, we're going to see articulation with the acetabulum of the coxal bone. On to the leg. So the leg is made up of the tibia and the fibula. The tibia is medial. The fibula is lateral. It is not a weight-bearing bone. It does not articulate with the femur. I'll have to show you a figure to make this make a little bit more sense. But we have a medial malleolus, and we have a tibial tuberosity on the tibia, and then we have a lateral malleolus on the fibula. Basically, this is the outside ankle, and this is the inside ankle. They're actual features on the tibia and the fibula. They're not separate bones. Okay, on to the bones of the leg. We can see the tibia. This one's going to be medial, and it's thicker. You can see that it's weight-bearing. So we can see what's directly above is the femur, and the femur sits here. So the majority of the weight from the femur is distributed onto the tibia. The fibula, this is the lateral bone. It's on the outside, and it's really support. We're really going to say ankle support. So here we have the lateral malleolus, which is here. We have the medial malleolus, which is here. So the medial malleolus is on the medial bone, which is the tibia. The lateral malleolus is on the lateral bone, which is the fibula. We can see at the top here the tibial tuberosity. This is the bony projection directly below your patella or your kneecap. So we might think of that as our shin. We're going to see muscle attachments here in the form of our anterior tibialis when we get to muscles. On to foot, where we're going to look at the tarsals. There are 7 bones. The majority of the body weight is going to end in the talus and the calcaneus, but there are others. There's a cuboid, navicular, and a medial, intermediate, and lateral cuneiform. Again, when we look at the tarsals, the metatarsals, and the phalanges, it's very similar to the setup that we saw with the carpals. So here's our calcaneus and here's our talus, and we need to know those specific bones definitely because these are the weight-bearing bones. So all of the weight from the tibia is going to be dispersed on these 2 bones. And basically your calcaneus is your heel. Then you can see the navicular is here, and then we have the medial, the intermediate, and the lateral cuneiform, and then this one is the cuboid. So that's 7 for the tarsals. For the metatarsals, again, these are just the bones of the foot, and then the phalanges here are just your toes, right, that extend off of the metatarsals. Again, we have a distal, a middle, and a proximal. And one of the things I forgot with the hand was to show you that there is no middle or medial. So for both the thumb and the toe, there are only 2 bones. There's the distal and the proximal phalanx. That's it. We do not have a middle on the toe or the thumb. On to some differences between the male and the female skull. I think it's good just to point some of these out. You can do general characteristics. So you can see that the male cranial mass is more blocky. So this is more of a block shaped, and where the females is more of a vaulted shape or tapered around. The females have the supraorbital margin that's sharper, and the males is more round and dull. So more rounded eye, upper eye or superior eye socket, where the females again is more projection. Zygomatic bone, these are your cheekbones, right? So in the male skull, they stick forward, they kind of jut out, where the females have a more of an up angle. The mandible of the female is more round. Again, it comes to a point where we can see the males is a little bit more blocky. Males have a deeper cranial mass. No, it doesn't mean they have larger brains, right? There's just this deeper, more space from beginning to end. Male teeth are usually also more square. So what are some general characteristics we could say just by looking at this one slide? This is more of a blocky, if you're male, blocky shape, and this is more of an angular shape. There are also some differences in the male and female pelvis. So you can see here the pelvic brim. You can see that in the female it's much wider, and then in the males it's much sharper. Same thing with the pubic arch. So it kind of is the opposite of what we saw in the skull. Now we're going to see a wider, more roundish shape with the female, and the male we're going to see more angular shape. I like this side view so that you can actually see the sacrum and the coccyx on the female versus the male. So again, females are going to have to be able to give birth, right? So we're going to have to fit the fetus out through the opening, and the way that the pelvic canal is tilted, you don't want the coccyx or the sacrum to get in the way. I like this inferior view as well, so that you can see we're looking from underneath, inferior, into the pelvic cavity. And you can see here this pelvic inlet is much rounder, and that the coccyx and the sacrum don't jut into that pelvic inlet. And then you can see this is more of a heart-shaped design for the pelvic inlet in the male. So again, this structure would be much more beneficial to childbirth. I want to focus on these fontanelles. This is the last couple of things we need to discuss with the chapter. This is the anterior fontanelle. There is a posterior fontanelle. There's a mastoid. Remember, there's a mastoid of your temporal bone. And then there's a sphenoid near the sphenoid bone. So there are 4 fontanelles, and basically these are openings because brain has to grow, right? So as we move from fetal development into adolescence, the brain is going to develop. These bones are going to fuse together to form sutures. But right now they're fontanelles or soft spots. Maybe you're more familiar with them. Also think about the fact that the fetus has to be able to fit through the vaginal canal and out, so you have to have a little bit of room to manipulate some of these structures. So multiple purposes for having fontanelles. When the spine is developing, I want to talk about the fact that there's a sacral curve and there is a thoracic curve. So these are obvious at birth. We call these primary curvatures, and they give the spine its C-shaped. This is going to change. As an adult, the curvature of our spine is a little bit different. So here's our thoracic curve, and here's our sacral curve. We said these were primary curves present at birth, right? So these are the first curves that you get. Then we develop these secondary curvatures later in life. We have the cervical and we have the lumbar. So the cervical is actually going the opposite way, right? And so is the lumbar. The cervical curvature comes with about 6 months when we start picking up the head. Right? We start arching our back, we're lifting our head up, and we're developing muscles and the curvature for those muscle attachments. And then when we start to walk, this is when we develop our lumbar curve. And again, until you develop the muscle attachment along with this overall curvature of the spine, this is why a lot of babies, when they're walking, they fall flat on their face when they're first learning how, right? So it takes a lot of muscle coordination and a little bit of time for these to occur, but the thoracic and the pelvic are your first kind of natural present at birth curves, and then you develop cervical and lumbar as you age. Lastly, we can look at abnormal curvatures of the spine. So scoliosis is when you have an abnormal lateral curvature. So the spine is basically curving to the outside, either right or left. You can have kyphosis, which is hunchback. So this is when you have an exaggerated thoracic curve. It usually happens due to osteoporosis, which we haven't talked about, but pores or holes in your bones. And then we have something called lordosis, or sometimes called swayback, and that's when we have to have this lumbar curvature, over-exaggerated lumbar curvature due to weight distribution, especially in pregnant women. So as you're shifting your body weight forward, you develop this lordosis or swayback curve.